Okay, so can you see the presentation?
Yes, Doc.
Okay, sige. So, since I have a meeting by 9 o'clock, so I will start our discussion na. So, for the recap, so medyo ano lang muna natin yung recap natin. So, maybe that will be done on Monday. Okay, so as a continuations of our discussions in cardiovascular system, we are now on the congenital heart diseases. So, last time we mentioned or discussed on the different problems, okay, affecting the different layers of the heart. And so it affects the endocardium, the endocardium, the myocardium, and of course the pericardium. Okay, now we continue our discussions, and for the congenital heart diseases, these are more of the anomalies. Ayan. Oh, by the way, hindi ko bubuksan yung. Okay, just let me know if you don't understand the discussion because of lagging connection. I-ano nyo lang, mag-unmute kayo kaagad, tapos sigaw kayo, no? Pag di ko, para marinig ko or mag-chat kayo kasi nakadata yung phone ko. Okay, so for congenital heart diseases, as what I mentioned, this is so since the term congenital, so most of the problems can be seen as let's say improper development. So depending on the functionality that can be affected or manifested once there are not incomplete, okay, development of one chamber, structure of a chamber, or a septum, or a portion of the heart layers. Yeah. So it's very, very significant because this affect the survivability of the animal. And I've mentioned during our previous discussions that in the compensatory mechanism that the heart is doing, it needs to have a good or healthy heart, okay, as one of the requirements, okay, to be able to compensate for a particular condition. Now, the severity of the lesions in a congenital heart disease depends on how the underdeveloped or anomalies that can be found either in one side, either one or two or three, depending on the affected regions. Yeah. So development or underdevelopment. Okay, in the general considerations to assess whether an animal has a problem, okay, affecting the cardiovascular, particularly kapag may differential diagnosis ka that the animal is suffering from a heart problem. Okay, first, at a very young age, usually young, yeah, the clinical signs that can be observed are cyanosis, fatigues easily, collapses or breaths heavily on exercise, or abnormal cardiac sounds. So most of this kasi naman, no, especially sa mga human, we have also the newborn screening. Ayan, aside from congenital diseases that can be assessed. By that time, syempre may assessment physically, ayan, na ginagawa dun sa tao. So in the animal, so most of the assessment can be seen. Pwede rin gawin yon, however, some screening is not conducted, okay, in animals. So most of the time, the observations happen to be in close coordinations with the veterinarian, and of course, some expertise, especially in this specialization in cardiovascular, and assessment, okay, general health of the animal. And of course, you need to integrate also the clinical history. And okay, cyanosis, this is the bluing, okay, the bluish discolorations that you can observe in a young animal. So this cyanosis is an effect of the under-oxygenations or lower or reduced oxygenations. Particular area that can be cyanosis are those distal portions. So, and it can be assessed through sa mga mucous membranes. Kasi at the mucous membranes, these are very vascular, in which yung mga peripheral blood vessels are be seen. Okay, so these are the first one to be affected. Okay, fatigues easily because of the under-oxygenation. At the same time, the way of the heart, okay, or the body to respond to that particular conditions kasi may problema nga. So it's not enough, okay, for the circulation to circulate oxygenation. Okay, so if that happens, no, as a domino effect, some collapse or breaths heavily in exercise. Sometimes, in yung breaths heavily, there's a deep um, breathing. However, minsan meron ding increase in the heart rate depending on the anomalies. Ayan. So dito, kaya hindi niya ma-tolerate yung exercise because of the reductions of oxygenations. And the last one, this is very common, especially if you assess the animal through auscultations, you may hear cardiac sounds, abnormalities, some murmurs, yan, some arrhythmic conditions or arrhythmic status, okay, of the activity of the heart. So the causes of congenital diseases could either be genetics, infectious agents, and teratogens. So these three factors might be the common consequences once a pregnant animal is exposed to this in the environment. The genetics one, pwede kasi itong inherited, okay? May mga lethal genes, but the infectious and teratogens might be an exposure, okay, during the development or early development. That once these infectious agents or teratogens enter, okay, to the animal's body and penetrate through the developing embryo. Okay, so those byproducts or foreign products na meron sila or materials na yan, they could incorporate or hinder certain development. So depending on the pathogens and depending on the nature of the teratogens. Ayan, kasi teratogens, you have heard this in our general pathology. So teratogens are those factors or entities that could render a developing fetus or developing embryo to become parang a monster-like because it reflects or affects the development, especially kapag actively dividing. Yan, yun yung mga, those are the cells that are very susceptible to changes, lalo na during the differentiation. Yeah, so differentiation stage, okay, mga cytodifferentiation stage. And then as it will be affected no, during the organology, so some changes in the protein, etc., or any of the macromolecules be incorporated. So pagdating doon sa structural development, then that will be the time that some portions are not fully developed or abnormally developed. Ayan. Okay, so as for the genetics, so some examples that support the genetic cause for the congenital disease are single or multiple gene defects. Most species have mutations, and of course, for the infectious agent, so you have heard about some viral diseases, particularly parvovirus. So I've mentioned this one because parvovirus characteristic or the virus of mga parvovirus, no, the parvoviridae family, no, they do love to replicate in the actively dividing cells. Yan. So if those are affected, no, then tendency is that portion wherein these dividing cells are very important too, so it might not develop or improperly developed. Another's blue tongue virus in sheep, same, and the bovine viral diarrhea in cattle. So these are the most or the common three infectious agent that affects, okay, the developing embryo, developing animal, and sometimes they produces malformed animals or young or neonates that some of them might survive for a certain period of time, but most of the time they die afterwards. So, and then of course, the last one is the teratogens. So these teratogens, these may be due to a lot of factors. So it could either be deficiencies in the nutrition or excessive or excess yan, sa nutrition and some exposure to radiations. Yan. So other teratogenic compounds, these are chemicals, no, could either be thalidomide, ethanol, salicylic, glycerophobin, or cortisone. So that's why in human, no, so for them, if necessary, they should not be applied on different chemicals. Okay, yung parang i-lessen yung exposure or penetration of chemicals, especially on the first trimester. Yan, kasi yun yung pinaka susceptible or very critical period of development. Though the trimesters development naman is very crucial pa rin to complete, okay, an adult, to complete a normal neonate. However, in those time, no, it's the first trimesters that are very susceptible. So that is very applicable to animal. So what you need to know in animal is, first, you know how to understand the time of gestation. Now, if you don't know the time of gestation, you might that might give you parang questions, okay, in the differential diagnosis or in assessment. Kasi hindi mo alam how long is the gestations, when will be the critical period of development, etc. So it's better for you to know when is the how long is the durations of the gestation period, para you know to prevent, of course, okay, and control if ever there are some exposures, okay, to a certain conditions, and if possible, reflect or avoid giving any chemicals, okay, or administer any chemicals that are teratogenic or very effective pagdating sa developing neonate. Yan. So, those can affect talaga yung as early as that, okay, that might develop into congenital anomalies. Okay, so some common cases, before that pala, so some common cases that can be reflected that the animal might suffering from a congenital diseases is through cyanosis. And this cyanosis can be seen in these different conditions or considerations. So the first one is malformations with obstruction of pulmonary blood flow and intracardiac defect. That means that there is an obstructions, or relatively there is a malformations or stenosis or whatever that affects the circulations, okay, of the blood. And of course, the intracardiac defect is that there is abnormalities in the development within the structures in the heart. It could either be improper development of the septum, may opening, ayan. So those are some examples in the intracardiac defect that could result to cyanosis as one of the manifestations. So other than that is the intermixing of blood in a common chamber. So since you have the term intermixing, so those that particular structures that avoid the intermixing of blood might have anomalies. And so it might be not developed clearly, or not developed completely, or through and through, mayroon tayo. Another is transposition of aorta. So during the development, so in your embryology, I think let you memorize on the different arches and then their fate. Ayan, so ano yung nag-rudimentary and what arches parang nag-progress. Okay, so anything that affects those development. So some progresses and some are not. Then the transposition of aorta is one congenital anomalies in which the aortic or the aorta, the blood vessels aorta, has been moved or changes in position. So if that happens, no, so remember that aorta is a blood vessels that conducts oxygenated blood, and this is the largest, okay, largest blood vessels, okay, blood vessel. Okay, so another, so in this the last button here might reflect parang consequences or sequel, okay, that might be seen in the adjacent tissues if ever there are congenital anomalies happens in the heart or the cardiovascular, especially in the heart, no? that might also lead to the development of lesions, functional lesions or clinical lesions doon sa adjacent um, organs or adjacent system. And the most critical organs that can be affected there is the lung. Ayan. So these are the four considerations, especially if there are assessment of mga cyanosis. Ayan. In most of your physical assessment dun sa animal. So you might consider this three. Ayan. Parang references, okay, to look for if the animal is suffering from congenital diseases. Now, the important features for the congenital diseases might be classified into two features. So we have the primary features and the secondary features. Now, for the primary features that relates to the anatomic details of the malformation themselves. So ibig sabihin, those structures. Okay. Now, the secondary features naman relates to the anatomic changes resulting from the malformation. So this is more of like the consequences. Ayan. So what will happen if there's malformation? Then this will develop, or this will be as a response. Okay, that's why when you assess, you can see my dilatation, my hypertrophy, my distortions of that affected structure. So that's the secondary features. Okay, now for the grouping of defects, we have 5. So we have the obstructive lesions, the valvular insufficiency, opening at ventricle level or great vessels, opening at atrial level, and transposition defects. So I've mentioned this one, no, sa grouping defects natin, this is actually anchored dun sa considerations natin, dun sa mga malformations, yan, and dun sa may cyanosis kanina. So we have the obstruction lesions that you might have an idea in the movement or regulations or the flow of blood. Valvular insufficiency if there's intermixing. Opening at ventral level of great vessels could either be intermixing kasi there is no complete holding on to the or that limits, okay, the movement now, okay, of the flow of blood. So because of the patency present in those ventricular level, same to in the atrial level. Okay, and transposition defects are more like supporting the transposition of the aorta. Okay, so now what could be the effect of the outflow obstructions or blood flow restrictions? That is to answer the first one, the obstructive lesions. Okay, the effects could include there is a development of turbulence as blood passes the obstructions causing cardiac murmurs. So in our previous discussions, we discussed on the jet lesions that it looks like a corrugations. Okay, because of the turbulence of the blood of some pressure. Okay, so another is chamber enlargement and hypertrophy due to high pressure. So I mentioned again, pressure on the proximal side of the obstruction. So since hindi siya makapasok because of the pressure, might be because of my hypertrophy na yan. So the accumulations of that particular blood, okay, on the proximal side. So like for example, if this is the atrium papunta sa ventricle, no. So may stenosis, or let's say may hypertrophy that led to a stenotic lumen, okay, in between those chambers. Then what will happen? So the accumulations of blood will be on the proximal side. So if that happens because of the pressure, then yung turbulence niya, okay, so may ganon, yung push niya ngayon, so those can be the cause of the jet lesions. Okay, another is damming of blood in the lungs leading to hydrothorax and congestive heart failure, especially on the left side. So what happened? So left side. So if you going to imagine, so in the left side, so at the left side kasi level, from the lung, papunta sa left side of the heart, that will be oxygenated blood. So from the lung, the pulmonary vein, and then the atrium, and then of course the what do you call this one, left ventricle, and then the aorta. So if there is problem, okay, in the left side of the heart, so there will be damming on the atrial part. So what will happen? So mapupush ngayon yung pressure papunta doon sa lung, so hindi siya makapasok. So that will give a tendency of damming the lungs, okay, with blood. That could lead also to hydrothorax because of the pressure, di ba? In our that could lead to increase in the pressure and then dilatations, and at the same time, um, one of the marami ng possible mechanisms that could lead to the release of fluid to a certain area. Okay, so those are some of the pathophysiology that can be seen if there is blood flow restrictions. So another that also support that one is the aortic stenosis. So I've mentioned this one, the aortic stenosis, just a while ago, incorporating it from the discussions that I've just mentioned. So in this aortic stenosis, you have this partial fusion of aortic valve where left ventricular hypertrophy occurs secondary to increased pressure, resulting to concentric hypertrophy. Now, if you will going to uh, relate this one to the to that condition that we just discussed, no, dito sa last button na yan, ito, this one. So yung chamber enlargement and damming of blood. So I've mentioned about this stenosis. In this area, the stenosis happened to be at the left side. Okay, due portion, no, yung portion na to, yun yung nag-led to become stenotic, yung area ng aorta. So what will happen? So the blood papunta dun sa aorta. Ayan. So ano mangyayari? Pwedeng yung area dito nagkakaroon ng dilatation. Ayan. So yung portion na yan. Okay? So the actual picture, ayan. So there will be enlargement. And then dito sa may area, dun sa proximal level. And then of course, you have the subvalvular lesions common. Okay, dun sa may valvular lesions niya. Okay, the pathology shows alterations in the endocardial tissue, some mucinous ground substance, and foci of cartilaginous metaplasia because of the continuous, there's a continuous accumulations of blood in there, the damming, the turbulence, the jet lesions. So those are some of the factors that could lead into a metaplastic change. Okay, so another that is under the aortic stenosis. Now another is the pulmonic stenosis on the pulmonary part, okay, yung pulmonary opening. So result conditions is again the concentric hypertrophy of the right ventricle, and at postmortem findings, the one affected in here is the systemic circulations for the hepatomegaly ascites. So naiiwan doon, hindi siya makapasok. Ayan, so nagdadam sa baba. Okay, so that's how it happens. Now that's pulmonic stenosis. Now another is the mitral or the bicuspid stenosis. So when we talk about mitral stenosis or bicuspid stenosis, we are on the left side. So this is how it happens. Okay, so lilit dito because of some hypertrophy on the side, which led to damming of blood on the proximal, on the on the proximal na hindi siya makapasok. That's why there is enlargement of the vessel, of the chamber. Okay. So this also valvular insufficiency could be one of the effect. Okay, so if you will notice, no, all of the considerations that we have mentioned a while ago is connected to each other. So for the valvular insufficiency, this is the worst effect of valvular insufficiency, regurgitation of blood, which cause cardiac murmurs, and that will result to enlargement of the chambers on each side affected if there is insufficient valve activity. Okay, so another is that the valvular become dysplastic. So you see this, the jet lesions, because the turbulence of the blood flow still there. Okay, kasi meron tayong mga parang the volume of blood. Okay, kasi dire-diretso lang naman yan. So the volume of blood is there. So the primary lesions that can be seen is through the turbulence of blood. You have the jet lesions here. So this is the defect under the valvular dysplastic dysplasia, the changes in the valve structure, the structural changes, okay, on the valve. So if I'm going to ask you what among, which among the features, so it's more of the primary features in here. Okay, so next is the valvular incompetence. So the valvular incompetence, so this will look like parang both enlarged chambers, the right atrium, the ventricles, because of the valvular incompetence. So wala na siyang control. It will dump both the chamber. Okay, so if this happen, ano ulit yung pwedeng kamatay? So we have this cardiac tamponade. So that could lead to death to the animal. Okay, so that's the blood flow restrictions and of course the valvular insufficiency. Now we have this ventricular level opening. So patency. So this opening at the ventricular level effects include intermixing of oxygenated and unoxygenated blood. So how will this happen? So we have the septum. So at the ventricular level, different ventricle, different chambers of the ventricle contains different nature of blood. So the right ventricle has the unoxygenated blood, and the left one is the oxygenated blood. So if the septum behind, okay, yung opening, if there are, there might be an intermixing, and in that intermix is not good. Volume is there, yes, but the nature of blood that can be now distributed, okay, in the body is intermixed. So parang the expectation of the body to have 100% oxygenated blood will not be like that again anymore because of the intermixing. So another one, the severity of that intermixing depends on the size of the defect between these ventricular level. So actually, it's self-explanatory on how it would affect, okay, the systemic function, the functionality of the heart in terms of the blood flow and the nature of blood to be distributed. So another, as a resistance to flow increases, the magnitude of cardiac enlargement hypertrophy also increases. So that's how, as I mentioned, how the heart, okay, try to compensate for that matter. However, as we already discussed, no, one of the requirement is the healthy heart. Okay, so in this portion, no, hindi siya healthy, but then again, it will try to compensate for a certain level. Ang nangyayari lang dito, the lesions that is present in there can be exacerbated, and it might become more worse. Okay. Yeah, so another is, this is a picture of the ventricle septal defect. So in between, there's an opening. So behind this defect is a failure of complete development of the ventricular septums, allowing the shunting of blood. So we've mentioned that one. This could occur singly or in association with other defects such as the transposition defect. So mamaya, so later yung transposition defect natin. So usually high in the septum, often behind the cusp of the left atrioventricular valve. So in short, about the endocardial cusp, okay, as a remnant or to the development of valve, okay, during our discussions previously. Now, what happened here? There is blood squirting, producing valvular incompetence, that's the jet lesions, and right atrial dilatation. Kasi since may opening dito, merong pressure, may volume dito, so magdadam. Okay, may daming dam nakikita. Same. So it will affect the turbulence of the blood. So this is the okay. This picture shows you the other defect, no, aside from the atrial septal defect, the ventricular septal defect, and the patent ductus arteriosus in the aorta or aortic lever that's supposed to be closed, okay, after parang delivered out, okay? So pag lumabas na siya, magko-close na dapat yan. But what happened here is there is a patency, okay? There is a connection. Yan. So yun ang problema natin. Interventricular septal defect. Ito naman dun sa gitna, no? Okay, so we have the interventricular septal defect in here. So actually, the location of the septal defect is already mentioned in the title. Okay, it's already mentioned on the anomaly. Kaya the locations you can now locate, or you can have an idea where to find those kind of septal defect. Atrial septal, ventricular, or interventricular septal defect. So a defect of membranous symptoms, so this is the membranous symptom, which are very, very common. So occasionally the muscular part of the septum is not or is affected, however, yun nga sabi, not common, it can be associated with overriding aorta. Okay, so that's the conotruncal region on the aortic level. Ito yan. Okay, so yung malapit naman dyan. Okay, so dyan naman predisposed breed of animal is the bulldog. So this is the hemodynamics being affected. So there will be overload the right ventricle, which increase the right ventricle pressure. Now, this right ventricular pressure will also affect the right ventricle. That will lead to the development of right ventricular hypertrophy and the right ventricular failure. Ito na yung parang output, okay, of this right ventricular hypertrophy. So there will be right ventricular failure. That is when blood shunt to left to right, but it could not reverse later. So hindi na makabalik, but there's a shunting from left to right. Okay. So yung left, so there is oxygenated, papunta sa deoxygenated, then hindi na siya babalik, but basta circulate. So that will be a problem. Okay. So next is the opening at the atrial level. So blood. So the defects are usually large that chambers occur with a tendency of right to left shunting. Okay, for the interventricular valve, there is no chance for a reversal, parang intermixing. Okay, not unlike the atrial. Okay, at this level, may parang going in, parang going left to right. So in that manner, no, so there is an equalization of both atrial level or volume. Okay, so that is a shunting, that's the pressure, equalization of pressure between. Kasi dito, mas mababa siyang konti kaysa sa atrioventricular level. Okay. So this is a picture. So as you notice, no, this is quite large. Okay, in between the septal of the atrium. Okay, so imagine ganyan kalaki, mas malaki pa yata sa 5 piso or yan 10 pesos, no. So how might be the animal parang suffering from that, no, kasi hindi na siya masyado siguro makahinga or nahihirapan na siya, pwede siya ma-collapse. Yan, so those are some of the assessment. Ayan. Okay, and then the patent ductus arteriosus, o to yun, dapat na magsasara yan. Ayan, we're in, same with the persistent foramen ovale on that area. So those are some of the patents in opening that could lead to shunting of blood. Okay, and much in normal development, this will close, okay, as the animal pag lumabas na siya. Itong foramen ovale naman, just sa early of life, pa-close pa lang siya, but habang after 1 week, 2 weeks, nagsasarado na siya. Ayan. Okay, so I guess, okay, sige. I will discuss the transposition defects. So transposition defects, the last one, I think. No, may other pang isa. So we have discussed on the flow restrictions, the valvular insufficiencies, the septal defect. Now the transposition defects. So for the transposition defects, this is often very complex and result to stunting of growth, cyanosis, and dyspnea. Okay, so this includes, so these are the important, also for you to understand, the tetralogy of Fallot, the Eisenmenger complex, and the persistent right aortic arch. So these transpositional defects is composed of mga secondary, okay, features of the congenital anomalies. So like, for example, for your tetralogy of Fallot, so we have here four constituent, okay, that give rise into a tetralogy of Fallot defect, okay, or problem. So the overriding aorta, so we have the pulmonic stenosis, the ventricular septal defect, and the right ventricular hypertrophy. So if you will remember, we have mentioned this one during the yung previous discussions natin with regard to the congenital anomalies. So we have discussed on pulmonic stenosis as part that will lead to blood flow restrictions, ventricular septal defect for intermixing of blood. Right ventricular hypertrophy could be a cause of the flow restrictions or just an output if there is blood, okay, yung accumulations of blood. Okay, that's one. Okay. So the pathology of this might be seen in right side heart failure wherein there is a mixing of blood, okay, on this particular area. So this is due to unequal divisions of conus due to anterior displacement of the truncoconal septum. So yung trunk will be development supposedly of a septum separating all the chambers and the blood vessels here. So what happened? Nagkakaroon ng opening, yan, yung area na yan, and transpositions. Ayan. So that is a picture of tetralogy follow. Now, upon identifying if these different parang secondary features, okay, rising on the anomalies, no, is present, okay, through assessment, no, then that might give you an idea na meron tayong tetralogy of Fallot. Okay, so the tetralogy of Fallot hemodynamics. So first, there is a pulmonary stenosis that will increase pressure and overload of the right ventricle. So that will lead to right ventricular hypertrophy and led to, sabi nga kanina, heart, ano yan? Congenital, yung congestive heart failure at the right side. No? So there will be right heart failure plus the increase in the right ventricle pressure. This will now shunts blood from right to left. And that venous blood into completely good kasi intermixing of blood. So this can be seen inherited to Kish Hunt or some of the English bulldogs. So parang may nabanggit na rin ako kaninang bulldogs, no? So these are some of the breed predispositions when it comes to congenital diseases. Okay. Now for the Eisenmenger complex, so this is similar to tetralogy of Fallot. However, in so meron tayong isa dito, that is this pulmonic stenosis. So there is no pulmonic stenosis, but the other overriding aorta, right ventricular hypertrophy, the atrioventricular septal defect is present. Okay, that's the Eisenmenger complex. Kaya nga sabi ko, when you do assessment on the secondary features of that anomaly, no, arising from the primary one, you see, okay, kung ano yung mga possible conditions present, and then you can assess whether it is a tetralogy of Fallot or Eisenmenger complex. Now, the last one there is the persistent right aortic arc. Okay, so I think you have heard about this, the PRAA. So this is the aorta, which supposedly the right one should be regress. Okay, should regress during development, only the left heart. So what happened here, if there is the persistence of that it could obstruct the esophagus. That's sometimes one of the lesions found is the megaesophagus because of the vascular ring having to be developed at this proximal portion, okay, of the esophagus. Okay, so aorta comes down the dorsum of the esophagus, the ductus arteriosus attaches to the aorta behind the esophagus. So this is the normal supposedly. However, because of the presence of the right now, there will be vascular ring entrapment of the esophagus and trachea, which, ayan, so ito yung locations where you can see this anomaly. So the descending aorta, the ligamentum arteriosum, main pulmonary artery, and the heart piece. So at this area, no, so this is the composition of the vascular ring, okay, anomaly. So the esophageal dilatation proximal to the constriction result to regurgitation. That the manifestation of that regurgitation is vomiting. Kaya if you see animals, especially mga young animals na nagvo-vomit, one, do not forget to include congenital anomaly, especially the persistent right aortic arc. Especially na alam mong may mga bakuna yung mother, ganito, you check for the ano yun? Management sa feeding, ganyan, okay naman, then you must try now to see or assess whether the animal is suffering from a certain congenital diseases, just like this one, PRAA, because it could also manifest vomiting. The worst happen here is the aspiration pneumonia. How it would happen, no? Because of the regurgitation, may opening tayo, no? That can be seen in the throat area. So those materials that are regurgitated might enter now the tracheal part, okay, from the yung regurgitations, okay, can enter now the the lung or the lung region, which could lead to aspiration pneumonia or inflammatory conditions because of these foreign bodies. So that's how it will be assessed, no? Especially pag nag-postmortem pa, you see their aspiration pneumonia. Okay, so the death of PRAA is due to most of the time aspiration pneumonia. And the predisposed dogs naman here, so kanina si Kishan and the bulldog, no? Dito naman again, meron tayong mga large breed and the Irish Setter dogs. Ayan. So yun yung mga predisposed naman dito. But however, they are not this PRA is not limited to this. These are just predisposed animals. So mas common sa kanila. Okay, so might be a little genes because of this one. Pero yung ibang breed can also develop this problem. Okay? So this is just a picture showing you the development. Okay, this is a 4 millimeter embryo showing you the different aortic arches. So hopefully you will still remember the fate of these different aortic arches in your embryology. So ano nagbibigay ng parang sa part ng larynx, ganyan. So the aorta, okay. So I hope you still remember kung anong fate ng 1, 2, 3, and 4 arches na yan. Okay, so as it developed into 12 millimeter embryo, so meron na tayong mga different blood vessels sprouting from this aortic arch. So we have the left dorsal for the that will give rise to an adult aorta, and the right portion is a normal development. It should be obliterated or mawawala yan. Then you have this portion dun sa una to develop into subclavian artery. So note the right fourth aortic arch remain and left fourth aortic arch remain here. Yan, pag nagkanto ng PRA, and left arch are the disappearance. Okay? So yun yung nangyayaring problema kapag persist yung right aortic arch. Okay, so for the abnormalities in the position, we have the ectopia cordis and the dextrocardia. So these are the common, which can also be found, okay, some in mga large animals. So ectopia cordis from the term itself, outside. Okay, so heart is located on the outside, and the dextrocardia naman parang both on the angle or parang part of the yung position niya, okay, in the thoracic cavity is in the middle. Okay, parang ganyan. So, kasi, di ba, if you remember, I don't know, in your physiology, the right location, or anatomy, the right location, parang deviated siya ng konti sa left. Okay, yung base niya, and then yung apex na papunta sa gitna. Okay, so later we will talk about that. Okay, this is ectopia cordis, in which the heart is found on the upper or proximal portion of the thoracic cavity. So most frequently seen the subcutis or the neck, or subcutis, ibig sabihin just behind, okay, yung the thoracic cavity. Usually secondary to sternal cleft or field of thoracic cavity. Ibig sabihin there's an opening. That's why the cavity, because there is an opening in the sternal region, there's a rib cage. Okay, so some animals can survive for several days, but definitely it will die. Okay, so very prone. Why? Siyempre nakalabas, and very vascular, and then siyempre it should be supported by the hardiness of the dito, ng thoracic cavity also to hold that. So since nandito siya, mag-hold dun sa heart. So that led also for the animal to die. So aside from that, siyempre it's its conductive activity and contraction ay hindi naman supported on the subcutis. So that will lead to death. Okay, so ang most niyan, syempre may swollen yung area, yan, dun sa part na yan. Now, this is the dextrocardia, in which this shows yung heart is on the right side rather than the left. Okay, hindi naman sinabi na sa left talaga siya, no? or nasa right talaga siya. It's actually the deviations on the structure. Okay, so the heart is deviated pag sa normal sa left part, okay, kaysa sa right. So dito sa dextrocardia, baliktad. Okay, so this is often associated with total or partial situs inversus or the mirror image. So bumaliktad siya. Okay, left to right symmetry. So it could either be due to ciliary dyskinesia or Cartagner's syndrome. So this will see in situ, ayan, so inversus yan, so inverted yan, dextrocardia is inverted description. There will be total lack of ciliary movement, that's why yung ciliary dyskinesia, and usually fatal. Okay, so that is the congenital diseases in the heart. Okay, next will be pathology of blood vessels. So I guess I will be discussing this next meeting. Medyo nag-over, overtime. Sorry. Can you still hear me?
Yes po.
Yeah, nag-overtime tuloy ko. I'm sorry. I think you have a next class. So on Monday, we will discuss. I think hindi naman yata matutuloy yung pagpunta ko sa ano, but I will let you know, no, kung matutuloy kami pagpunta na Laguna. However, if not, no, I will discuss online. Okay, para matapos na ang cardiovascular system. Matatapos na yan, blood vessels na ako. Get ready, be ready. We might have, I will going to discuss na lang. O sige, online muna tayo. Kasi magpapareview ko kanyan, paridiretso ko na lang na respiratory if ever. Okay, so I guess you have class. Now, if you have questions, we will answer na lang yan on Monday. Okay, so thank you very much. You are mga wala. So I hope you learned something from our discussion today for congenital heart diseases.